healthcare system. And in that aspect of better facilities, better equipment, and then even in diagnostic equipment, as well as recruiting and providing monies for our young folks to pursue careers in healthcare. Ishin kato, panil kito listo kato shi kwaiki. Not so see kite nisto lis. If each of the ones that address the committee would review the priorities that you apprise the committee of, if you could forward that to our legislative advisor, again, we would look at formulating that into an official Navajo Nation position. Again, with the same parameters, to hopefully do it within a time period of 15 days where Nabakia committee would be able to act on it. And then, of course, with your Title I group as well as the Title V group, communicate that to your colleagues, respective of the budget priorities for each of the entities, and we will formulate that into an official Navajo Nation position. What Senalito, really, committee members, before going any further, could we have a motion to establish accepting this update?
Motion, hello. This is Mark Ihs with the area. I just have a last comment that I would like to provide.
Okay, just a minute. Let me recognize Honorable Pernell Halona's motion to accept the report.
Second, Delegate Slater.
Thank you, Cecilia. Honorable Vice Chair Carl Slater seconds the motion to accept the report. Now, Mr. Marquis Yazzie, go ahead.
Well, I just wanted to say that here at the IHS, we are strongly committed to honoring the relationship between tribal governments as well as the federal government. I think it's through our partnership that we share the goal of implementing IHS programs in a way that is respectful of the relationship, that provides Navajos as well as American Indians all the protections in which they are entitled to. But the tribal consultation process has provided a much needed structure around the agency's process for obtaining advice and input on matters that have a substantial direct effect on tribes. So, in essence, the consultation policy here, at least through the tribal budget policy, I just want to say we appreciate the efforts by Navajo tribal leaders that have invested in consultation. And I feel that these efforts have resulted in many positive outcomes for Navajo communities. But I believe the consultation policy within the IHS has been overall successful. And I just want to ensure you, as well as the group, that it is serving as an effective vehicle for communicating your issues and concerns, and for working collaboratively with tribes, tribal organizations, or ITUs, for a better word. But we do welcome the Navajo Nation's feedback on December 2nd, and hopefully we'll have a little bit more discussion. But the OISD will keep you updated on the progress, and also on how we can help move this forward. But I just wanted to say that. Thank you.
Thank you. And committee members, I guess what's key to this budget priorities is the behavioral and mental health is a 638 contract that is held by the Department of Health. So we still need to hear from the Department of Health regarding that budget priorities within that program. Okay, motion, a second, and then now we can move to the water line projects. And I hope everybody still stays on the line to hear about those.
Good morning, Chairman. So this is Rosalind So, the Area Director for the Navajo Area IHS.
Good morning. Good afternoon. It's still morning, so good morning. Thank you for being on the call.
Yes, and good afternoon or good morning as well to all of the honorable delegates. I appreciate your time and the opportunity to provide some updates to you. I'm still trying to find a better way by which to share this information more broadly. There's a lot of activity, as you all know, around the water infrastructure for the Navajo people, the Navajo Area Indian Health Service responsibilities, as well as our collaboration with the Navajo Nation, Department of Water Resources, and so forth. So there's many things going on. I'll try to provide just a brief, high-level summary, and then follow up with a written summary so you have a chance to look at it a little bit more clearly. I do want to, I'll start though, not part of necessarily this report, but since my Sally has brought up the Delcon the Loop to Delcon water project. It's been about 30 days now since I was out there to visit that project and wanting to make sure that because their facility is probably going to be completed in advance of schedule, we have to make sure that our part is completed as well with the water project. So this is on our list to try to, we want to create a schedule. We want to create all the places where all the different entities, all the different players will come in and make sure that it's coordinated, because IHS has one part of it. We rely on NTUA and as well as NECA to make sure that that project gets completed. So that's our goal, is to still put a schedule together to make sure that it is consistent with the facility being completed. And I'll also just comment very quickly that with regards to Botaway Gap, that's also on my list. Something that I want to make sure that is completed before my tenure within the Navajo Nation, Navajo area. And so that project has been, I believe a majority of that project has been funded. I think it's 75 to 80% funded. The final planning documents are going forward for final review and discussion on that, as well as the Pablo Pintado. That is completed, and still looking for how we're going to construct that building. So just some other infrastructure updates as well. So I'm going to break down my report into probably 5 different categories. I'm going to start with the last one first, which is the Navajo Nation CARES Act funds. This is not necessarily an IHS project, but we are and have been involved in this particular activity over the past 3 or 4 or several months anyway. And so our role, of course, there was some funds that were set aside for the water projects, and IHS has been supporting the Department of Water Resources with public health officers. These are most of these individuals have been on the Navajo Nation before, so we were able to sort of handpick who we wanted to bring back to the Navajo Nation. We have completed, or we're completing the second team that has come through. These are, again, experienced engineers to help with the planning and the development, and then we turn it back over to the Navajo Nation for the final phase of that. And then we have one team that will complete by the end of this month, and then we'll have the last team, which has just been approved, that will come in sometime in December and finish their part. So there's a lot of coordination that is going on up for those particular funds. Again, these are the Navajo Nation projects. 73 individual designs for homes and home site and cisterns and on-site water treatment systems have been completed. 69 design packages have been submitted to the Navajo Nation Department of Water Resources. So I think that speaks a lot to the coordination and all of the efforts put forth for IHS, the Navajo Nation, and all of the public health officers that we tapped into from all over the nation, nationwide, not just IHS. So we are particularly excited about those efforts that have been going on. And if you're not keeping up with all of the projects coming out of the WAG, this is the same thing, the Water Access Group. So there's been a lot of communication there, again, coordinated between the Navajo Nation and the Indian Health Service. So that's a lot of progress has been made and a lot of great communication and partnerships developed along the way. So going back to IHS specific funding, these are the Public Law 86-121. Again, what I would offer here is that the Navajo area program has completed 37.2 million in new projects and new project summaries and MOAs for 65 projects with approximately 1.7 million contributing funding from EPA and 5.15 million of CARES Act funds. So there's a lot, again, coordination there. We will continue to monitor all of these activities that are going on. With regards to active projects, again, these are in the project database system that we have. We currently are reporting 897 projects that have been funded for the dollar amount of $543 million. These are just the funding that comes through the Indian Health Service process. 64 of these projects are in the planning phase, either the planning agreements or the MOAs. 318 projects have been fully funded and in design phase. 98 projects are in construction phase, and 417 of these projects are in either post-construction phase or just finalizing the final projects on those. So again, just to demonstrate that even though we say that there's 897, close to half of those have been completed or just pending the final report and turning everything over to either the homeowner to the Navajo Nation. With regards to SDS, again, we do report and have been reporting to the Navajo Nation, and the last report was submitted on November 13, 2019. And that lists 367 reportable projects totaling $520 million. And we believe that 133 million projects are considered economically feasible for us to complete. The CARES Act funds, these again were the contributing funds from the Indian Health Service. This was way early on when we were just trying to make sure that there was at least water access to many of our families and community members. This has totaled, at this point, $5.15 million that has been put into this. This has provided for 59 temporary watering points that have been established at the chapters, and then approximately 2,300 water storage containers have been delivered to 61 chapters. We're waiting for an additional delivery to 48 chapters. We're hoping that will be sometime this month, waiting on the supplier. And then we're also anticipating that the disinfectant tablets will also be delivered to the chapters. Again, this is being held up a little bit by the supplier as well. And for all of these projects that we're talking about, the water fees are being paid under this project using CARES Act funds and managed by the Indian Health Service. I talked about the Water Access Coordination Group. Again, a lot of coordination that's going on with all of the private industry, universities, BIA, IHS, and so forth, including the Navajo Nation. So that's been working very well. Some best practices, I believe, are coming out of there. Indian Health Service, we are in the process of trying to bring on nearly 20 engineers that will continue to help us with these projects, and that we're working as fast as we can to clear individuals that will come on, as well as filling the critical positions. We lost one of our senior engineers out of the Tuba City area. That's a big loss to the Navajo area. The good thing is he's in IHS headquarters, so we can still tap into him, and we intend to do that. So, Mr. Chairman and delegates, that is my report. Thank you.
Thank you, Ms. So. Committee members, any questions?
Chair, I had one question, Helona.
Oh, go ahead, Honorable Helona.
Oh, good morning. Good morning, committee members again, and all the presenters. Good morning. Thank you for showing up today and giving your presentations. I surely appreciate it. There was some new information there, and then a lot of repeated, but of course, repeating is better than nothing. Good morning, Rosalind. I just wanted to ask about your water program. How long will that last on the watering for the water at the chapter houses before we have to start charging them for that? Is there a limit on how much we have to that we're shooting for, or is it just open for right now until the pandemic ends? Chair.
Go ahead, Ms. So.
Thank you. Thank you for that question, Delegate Helona. So that's a very good question. I know at this point, I have not heard that there's a deadline. I know there's a deadline on the tribal side, but, Indian Health Service CARES Act dollars are what we call X dollars, meaning that they don't necessarily expire on December 31st. But I will follow up on that question and make sure that we get a response to you on that.
I really appreciate that. Yeah, I'm getting a few questions on that, on how long it was going to last. So, thank you.
Ms. So, this is Marquis. I think I have the answer to that.
Okay, go ahead.
From my understanding is that the funds will remain expended, will remain available until fully expended or when the pandemic is over. So whatever comes first for those transitional water points, that's how the funds will be used, whether they're fully expended or when the pandemic is over, whichever comes first.
Another question I had is, after that pandemic is over, when that account is fully expended, then that watering points will still be at the chapter houses. Will they still be giving water out and also be charging the customers for coming, or will there still be a free watering point?
That's, from my understanding, with the Transitional Water Access Coordination Group, they are in ongoing discussions with NTUA of how that's going to be transitioned. So hopefully we'll provide additional information as that becomes available.
Okay, thank you very much. I appreciate it.
Honorable Helena, that's probably a question that would go to MTUA because it is part of, once the system is turned over, then they're the ones that administer it. So.
Okay, well, when we get around them, we'll ask them about it. I'm just curious to find out. I had a couple of questions that came up. Some people were asking about it, so how long they will be able to get water there. Thank you. Yeah.
Oh, I hope that the watering points, even though they're term transitional, I hope they're permanent.
So do I.
Yep. Okay, anybody else? Shemaya, Miss Amber Knezbot Crowdy, are you still on the line?
Chair, so?
Yo, Shiche, Honorable Paul Begay, go ahead.
Yes, thank you, Chair, Honorable Delegate Daniel So, also colleagues on the committee. Thank you for the report, Ms. So, Shehat, and all those others that have given reports today. People on the line, good morning. Yate. Just one question that kind of the question that came up last night through a conversation with another person. As far as the virus is concerned, COVID-19, I'm assuming that studies are continuing on what the root cause of it is. Through our conversation last night, there was a remark made that the COVID-19 is not so much a respiratory disease, but has something to do with blood, causing the blood to cut off oxygen, something like that. I don't have a mind of a medical person, but something like that, I think could be explained to us so that we can be better equipped to answer our constituency. Some type of an update on the study of this virus that we can share with our constituency, I think would be good. Thank you, Chair.
Thank you, Shiche, Honorable Paul Begay. Now, who would be best equipped to answer that?
Chairman, so this is Rosalind.
Yes, go ahead, Ms. So.
Delegates, I would offer that we can coordinate a call with our experts. You know, we've been leaning on a number of our individuals that have been helping us through this. And so we can set up a time to be able to give you more update. Of course, we have, you know, the value of our healthcare system is that we have enormous amount of data that we can rely on, and we're still having to have a chance to dig into that a little bit more. But education is key at this point, and if we can provide you with some additional information, at least what we're seeing so far, I'm glad to coordinate that, sir.
Thank you, Ms. So. Committee members, perhaps we could put that on Wednesday's agenda. If that's what the committee wishes to do.
That's fine, Chair. We can do that.
Okay, as part of the motion to accept the reports, then we could include that in the motion. Does anybody else have a question or a comment?
This is Delegate Slater.
Go ahead, Cecilia. Honorable Slater.
Thank you, Chair. So thank you to the presenters from IHS and Director So. I apologize if I'm asking questions that have already been answered during the presentation. My internet connection is incredibly unstable right now. Got everyone in the household trying to work remotely, and it's taxing it, so it's coming in a little choppy, and my cell coverage isn't much better. So first question is, for the CARES Act funding that I think Mr. Yazzie identified as spent or available until it's spent or the pandemic is over, for that funding and any other funding, has headquarters or the administration or Congress solicited any input on extensions beyond that, or the development of any sort of new programs to address the same issues that the CARES funding was set up to address? And then second, this is just a personal request for the district to Ms. So, if you could direct a staff member to work with us to set up another water projects update for Rock Point and Rough Rock, as well as a meeting with Saley Wheatfields on the projects there. I still would like to explore some sort of alternative contracting mechanisms to see if the nation could deliver maybe one of the projects in Rock Point a little faster than the ordinary process. And then last, this is, I guess, a request that I had placed on the last couple meetings for the committee to meet, to have a joint session with RDC to develop our strategy for getting every Navajo home connected to water, power, broadband, and making sure that they have a safe and adequate home over their heads. And I guess my question is, Director So, do you have any preliminary feedback on who should participate in that meeting and how we should, or that initiative and how we should go about it? And is it duplicative? Because I know we've had some water resource or water access group activities and some other activities that have taken place over the pandemic. You know, I want us to keep moving forward and not reinvent the wheel. But the idea is that this would be a request to the incoming administration. We would need all the data from IHS and then all the data from NTUA and any other relevant utilities to petition the new Congress and the new administration to uphold the trust responsibility to the Navajo people that they have. So those are the three questions right now. Thank you, Chair, and thank you, presenters.
Thank you, Honorable Slater. Ms. So, Area Director.
Good afternoon again. Thank you for that question, Delegate Slater. So yes, of course, I will coordinate another conversation with our team members and make sure that they work with you and your staff person. Additionally, with regards to a joint session, I think you know, using the model that we used for the water access group, which was in general very specific, meaning that we were looking at all of these projects that needed to get done, that we were all focusing on during this time, and of course to get them completed before the 30th of December was key. But using that same model to bring in some partners that might allow us to think a little bit different, I was really hoping that we could lean on the Army Corps of Engineers, but we've been working on a project with them at Gallup, and for some reason we're going sideways with them, and so I think I'm hoping that that's just an isolated situation. So I'm glad to help do whatever we can on our side. I know that we've been talking to our partners, including what we've been able to do to bring in a set of engineers with these teams that allow us that can help sort of maybe refocus or allow us to talk and think out of the box to get some of these big projects done. One of those is not necessarily in Delegate Slater's area, but it's really this Delcon project, which is very interesting because we've got to have water to that new facility, but it has to be carefully coordinated, and everyone has to be at the table to make sure that that the timing is completed and we're all on the same page. The players, what we're thinking is that we're hoping that we can get teams. We have to double up teams because we believe we're already behind in developing that project. So it has to be more than just IHS saying, well, we'll do this part, or the other key partners like the Water Resource and NTUA and NECA, all those. We have to all be at the table and almost in the same room trying to strategize how we're going to get this done. And what I've told my team is that we have to have some commitments. We have to say by, for example, by June of 2021, what are we going to get completed? So we have an end goal and not just keep talking about it year after year. So my recommendations, of course, the key players would include Indian Health Service, as well as the key players on the Navajo Nation side and other partners that we may have identified and established through this, what we're learning through the pandemic. Going back to your first question regarding funding, I think your question was just the source of the funding. I know that with the extension, I know that we have been involved with headquarters, and headquarters has been talking to other people, DOI, the White House, really trying to figure out how the extension can occur, if that's what you're specifically getting to on the tribal side, and you know where that's at in the process. On the IHS side, it's a little bit different. As Marquise has explained, those funds will be available until expended or the pandemic is over. So I'll pause right there and let me see if I answered your question, sir. Thank you.
Sure. So can I follow up?
Go ahead, Vice Chair Slater.
Thank you. Thank you for the response. Yeah, it's not on the tribal side. I was talking on the IHS side. I guess my question was digging more into whether the powers that be have seen the work that IHS Navajo area or across the whole system has been performed under the pandemic and sees results that is informing their future policy or appropriations decisions. And if that's the case, then what sort of questions are being asked of you essentially, and whether we can try and, infer something from that. But we can have that conversation another time. I think you've answered it the best you can right now. In terms of getting everyone in the same room, I guess I would just like to have a candid answer from you on what the limits are of your staff and what we can get done in the next, say, 5 or 6 weeks, as we enter into January. Should we just wait until after December 30th or what? I know you've been very forthcoming with your time, and I really appreciate that and your willingness to deliver reports to council and the committee in person. I'm just trying to think, our priority is spending the CARES funding, whether that's on the NTUA side, IHS, whatever implications they have in those different projects, chapters, et cetera. And I don't want us to slow down or inhibit that movement, but I also don't want us to get a document to the administration and the new Congress that will kind of get lost in the shuffle. And I know things that are submitted early on are good. If that's something you want to answer on the record, or you want to talk to the committee in private about what you can accomplish, no one's going to hold anything against you. We know you're fighting a pandemic. And then, Chair, the last thing is, could we add to Wednesday's agenda a report from Director So
Honorable Slater, we lost your voice connection.
Shoot, can you hear me now? Sure. So
Yes, we can now.
Okay. Add a report to Wednesday on vaccine distribution. I just feel like we've received some updates nationally and what have you. There's been different distribution calls that the White House has organized, and I, to be frank, have the most faith in our IHS Navajo area office as compared to anyone else who's trying to tell me about vaccines and tell me about the distribution plan right now. So that's my request to you and the committee if you're open to that. Thank you, Chair. Oh, and the one other thing would be an update on the surge plans. Just again, the incredible number of cases we've seen from this past week. It's really terrifying to think about how our healthcare facilities could become overwhelmed. And I know that Dr. Christensen had explained the different surge scenarios. And I think just for the record, if we could have her come back in tandem with Dr. So and explain where we're at and why it's critical for everyone to stay home and not travel this Thanksgiving. Thank you, Chair. Thank you, committee members. Thank you, Director So.
Okay, thank you. With that, there's additional requests. Ms. So, could we accomplish that?
Yes, let me try to go back to Delegate Slater's question with respect to, I think, the administration. I can look at the documents. Of course, Indian Health Service and all the federal agencies put together a transition document, and I think that we can share with you what we sent forward. These transition documents were put together before the election with the anticipation that if there is going to be a change, then we wanted to put our best foot forward in terms of sharing what our high level priorities are. So I'll look at that document, Delegate Slater, and see if I can share it with you. There's nothing in there that I don't think that's not confidential or anything like that. It's all of the things that I have been reporting to this group and other committee members. The second part with respect to just monitoring Navajo, I know that we've been asked from time to time, specifically during this last effort, that we're being monitored very, very closely by the White House, by the department heads, and so we do have to keep all of our information up to date to provide regular updates to our headquarters that moves up to everyone else that needs to have it. So again, those are not different or unique. It just really shows the collaboration and everything that we have learned as a result of this. And then with respect to Wednesdays, I think that the timing is perfect to talk about. Again, there's been a lot of conversation regarding the vaccine and how that might come forward. There's also information in the media specifically related to the First Peoples and how vaccine might be distributed there. But I'm glad to have Dr. Christensen and some of our experts on the call on Wednesday if that's helpful to you. So thank you.
Thank you, Ms. Doe. Committee members? Any other questions, comments?
Chairman Crow, this is Delegate Crotty.
Oh, yeah, Mayes. Go ahead, Honorable Amber Knezbach Crotty.
Oh, yeah, thank you, Shiaj. Thank you, committee members, and thank you for the report. I did have a question regarding, since we're talking about the budget formulation, what are the recommendations or what can we identify as a barrier for providing additional funding for the IHS identified water projects? My understanding, there's a funding formula which does a disservice to the nation, because I believe about a majority of the projects identified are not eligible for federal funding. If I could receive additional information about that, and I'm willing to have a separate meeting just on that subject. And also, then what should we anticipate for this next cycle funding for, I believe, is it 2023? And how, and if there's opportunities to work with Army Corps of Engineers to help IHS meet their capacity needs. Thank you, Chair.
Thank you. Ms. So?
Thank you, Shadeja, Amber. So with respect to the funding on the facility side and the SFC side, that does have a little different model than the regular funding that Indian Health Service gets. So I'm glad to set that call up as well, so you're clear on how those monies get allocated. This is a long history where OEH&E funds has been distributed differently, and I believe much of that's going to go to our capacity. As I was describing the projects that we have, there's a lot of work that has been completed, which is great. But what I want to know is what do we need to get to 100%, or even 75%, or 80% to meet the water needs for our Navajo people. And I think if we just keep looking at this as project specific, we're never going to get there, because we're having a hard time just sort of, for lack of a better term, walking in circles. And so I'm glad to set that up so we can better explain how the funding does come down for the water projects or Office of Environmental Health.
Thank you. Ms. Crowdy, that give you some ideas? And we could probably convene. I don't know how to best put it in the perspective of moving forward and not really just focusing, on the problem, but how do we address the big need, the funding for more projects. And that's where the data that NTUA, Division of Water Resources, as well as OEH of the area, IHS, I think that's where we can. And I don't know if the recent assessments that each of the chapters undertook as part of their justification to use the CARES Act monies, I wonder if that would also play into affecting getting more OEH dollars for water projects. Those are some thoughts, committee members. Like we probably have the proper data. We just haven't put it into one specific document. Any other questions, committee members? But for Wednesday,
Chairman, so
go ahead, Chamayaz.
I was going to recommend, Chairman, if the committee can call a leadership meeting regarding developing a water plan for Navajo Nation, so that you can call in all of the identified programs. And I would also recommend NHA. They also have data as it relates to individuals who want homes, but they don't qualify because they don't have the infrastructure. That would be my recommendation, Chair, if the committee can lead that discussion so that we have a solid plan for water. Thank you, as it deals with this health pandemic. Thank you.
Thank you, Samarias. We will request that approval. And certainly it's right at this point in time, it's timely, especially before the new administration steps into their work. This would be a proper document to present to them. Thank you. Committee
Chair, this is
members,
Delegate Slater.
Go ahead, Cecilia.
Thank you. I think on Friday when we accepted Mr. Yazzi's report, we included that as a directive, I don't know if it's a directive, but to you and me, to coordinate that leadership meeting with RDC. And I guess we need to make sure we publicize it to the rest of the council. And that's why I was asking the director, so if we could figure out what the real constraints are on her office and participating meaningfully in that conversation, and then because that'll inform when it makes sense for all of us to get together. And I think to a certain extent this does need to happen in person, and we need to find a facility or something after the government shutdown that will be able to handle that. Thank you.
Okay.
Mr. Chair, the committee don't have a leadership account. They just have a special meeting and regular meeting account, Mr. Chair.
Perhaps we can ask a speaker to let us use Nabi's special leadership account. Committee members, any other thoughts?
Chairman.
Oh, go ahead.
This is Thomas Walker. The
Philip, great to hear from you.
Ja, då gissen sa jag hon sa och det så där ilket då såna där det så vi det att hon ranjande.
Go ahead.
Okay. Yeah, showing again. Although honorable member of the Health, Education, Human Services Committee colleagues, although Shemaya's Delegate Crotty is on the line also, and then everyone that's participating in the meeting this morning up to now, all the presentations. At either instant, there you go. That was done there. Instantly, it's not because this ain't the never higher. It's not should I just say, quite who in Yenda Credo, the ne, ya, Chidat, as a Yatik Nido, Yanda, Ado, who is had at the car, not Sosia, a dated letter. It at a teacher, Bansakis, to the Diego, illegal Nanish, a dick instant, even not a Quinson, also, what the, and the way tossing the lip of an Nazago, in the Shiginte, what echo, Cochete, let all the nether that's Ilzeda, not Jaja, Yayin that in Shalto. Other that so Kayapaka that in the Shiki age never got teacher and the hot eggy the nation. Although not eggy be a quiet DD other also by Kahin. What are you a yard in such cases at Dashan and eight to the habit. In such case, a put out a Hello.
Oh, what did
Okay, all right. I wanted to comment on the presentations made by the 638 organizations, namely Winslow, Tuba City, just to let them know that, local leaders, elected leaders, chapters, health board members, certainly legislators, the delegates, and I'd like to just add my support to the presentation, sort of like testimony that was given to the committee here on the budget and health priorities of our respective areas, the areas that we represent. Certainly, as you know, I represent 5 communities out here: Southwest Western Navajo Agency, Bird Springs, Old Loop, Tulani Lake, Cameron, Coal Mine chapters. So those communities are served by Winslow Indian Healthcare Center, Tuba City Regional Healthcare. Those two are today by far most important vital services. Are depend on them. The presentation that they made, the listing of their budget priorities, what they'd like to see in the next couple of years as far as IHS dollars and resources and policies that they will be using and that they will be considered for. I stand in full support of the tribal organizations that spoke. The priorities that will be established by the different service units, though eventually Navajo Nation as a whole, although of course at the national level, and see case on his the dogs in Sobansa's case. So last year was different, the year before was different in terms of now how much great disparities we're seeing, health disparities, Native Americans and certainly Navajo compared to the other populations. But the disparities are just too great. What they call Yego shit is Albansas case of Shinanda Quagben Ada Ashenbiga and see Zoyat Fishpans and Danny Glindy Adolet Sahoid Adolet Abba. They had it Ato Abba Sati Kahot Dequah who undicate or Sati Katahakitash Ketaho Inson South Ayat Ado the Nihigi AU way. So the bit zero Asha Ben Dika. Though Navajo area, though these budget priorities, although advocating to the federal government, which is our key. What they call budget yati just a hanato you watching a year one day one donut and cannot liquid. Jibanan should they dagi 8 hanato. A codia catechin of answers case. Yard de Niki, Digi Ada Hashinil, Benanate Ango, a unique Nahaho, 3%, 4% increase at that. No, I said at Sanago, they had on the stop, the kite or be yat na dotlich be hat na dotlich be nabi don tesni go dika ben so be so ishin hanel decision to on sakis kako kwat ego at the niki by yelti o yat sunanta so yet yat saskis ditch a quite it sakis ya niche be hasti do lis beshkon hasana advertising so the IHS director with full respect and trust to our trustee has stated earlier, Delegate Slater saying, of all the agencies and federal government, you are the one that we trust the most. I feel that way as well. So for you to, your agency, your office to convey our concerns, at a much higher level than years prior as far as these budget priorities, need for increased funding is I can't even give you a number of what it is that I think we need. Because of the disparities that became evidently just so blatantly clear. Maybe we were living in denial, saying, "Oh, we will make it with this level of funding for the next year." That's they. Or ingo nahot is a link. Or sa decision and na kida more double as link. Aquajit shit na shado do cash indo do shik ashogando nahot is a ligi and then ati bahne kita it's ado nashni akot eko sani yot sani the nasado the kwanachi ohnet na the bentakis but so doesn't that's on hot that heki nissan go kwage nizam that he as link on G na halon ko it get hold so quick just is links and ko and then not auto on the rating card the license I just see la na the auto or such a yin the ya kissen so charge ben to the case la caution and hata ito be we set on net the kwage a quite end the tree nasnet niche see case do nasnet niche so cost a coto diga hunts case the doid assuran get the never cash in dot on kid net other but strategy that I netting but it in the bayel or what are you set up then has Johnson ko the vaccine comes with also the adding to the list of needs to focus on, need to prioritize testing resources. I believe there are adequate testing resources, but still we need to continue with that into the several months into the year and maybe even more. With testing, you could strategize. You could effectively, use that as a tool. We have to get into that frame of thinking. I don't needed treatment drugs, medication. Shin dinash nit nebedod na panhalia got ya bedod lithigi. Shin ye tanto krishna hadnigi ede so yo ye it ede la da hadna nit the klishi do ya klishi le hojo so yego one zaden hadn so ze ko hit eshin is ede bedahan to ye ban sas case ede all ban see case to by yel tigo ado the vaccine na kitad as has link johanna the rate careful age biots and the careful not kind of careful आज that it asahapa hata liago tasha. Aj it non-fat Indian Health Service are under a whole different administrative area. So aj Albuquerque judo what the I quite that way off Yahod na atan what did that look off? It never had that indicate Johnson that yeah Evan Saskatchewan although if you live near city or town also there are many concerns for our Navajo people. If we have inadequate supplies of testing, drug treatments, and vaccines while nearby, people are adequately supplied or adequately be served, that disparity is right there, I do believe that disparities exist in economics, in job opportunities, and education, in all facets of life. Unfortunately, that's probably the reality. It has been for a while. I'm not going to go down that path, but enough to say that from here on, we need to stand strong and firm as advocates for our people in this where we have dire need. This morning I got another report of an elder leaving that left, for the spirit world because of the pandemic, and just sitting here in sadness again. Although where that there was a woman whose husband, also passed away just several days ago. She don't have eta hollo. License other Ben Jensen. Connection so cosado Honda will yaki a be can leko. Ado let us send a labor cutters that shit had no. What then I don't take it in the adult head or little store. Net now in Texas go to the yard. Falchen do Handan she a bad hot leko. Yat Ashin had that or this is the Shadows the dog called never had adult ego destiny that destiny dog cut a big heart or the Hagida Bahazan the quiz card Jahat Lido the Edo is she Abahador Nito she what other yes or little certainly will include that in my prayers again on a daily basis. Shanant this chair social now yeah I some again. Oh, Cecilia. Nolan Juno. We hold it. I see. So, what's the quaggy citizen day? Needed me ho. So, Michelle ho. So, a share quaggy. It's good to hear your voice again. I see. The next catcher so cosy quaggy. So basically, see, about he wins him. I see. Well, the gun catcher had neatly. It grounds us, makes us think about the real issues as we look forward on how to approach the future, work with the new Congress and work with the new administration. Yeah. So yes, I see. What we're hoping to gather is enough information to know how to best formulate
a budget request. In that aspect, Ms. So, Navajo Area IHS Director, of the total IHS budget, is there a specific formula that's used to basically carve out a dollar amount that goes to Navajo area? And what are the factors that are used? Is it population? Is it respective of the healthcare facilities that are on the nation? And like Honorable Walker and Honorable Begay have stated that, you know, there is a great amount of respect and trust for how you've elevated the directorship to work with the Navajo Nation and the Navajo Nation Council. And I guess that's why some of these questions are coming to you. And then even the statements of a great deal of trust in your work and how you relate to us as delegates. Thank you.
Thank you, Chairman So and Honorable Delegates again, Sheha. With regards to the distribution of resources, so there's a number of things that are critical, I think, in terms of everything that we've heard today, not just from the 638 and what Indian Health Service puts forward as well, but the priorities are very important. The priorities in general don't change from year to year because particularly for the Navajo area, we know that our priorities have been somewhat the same over the past years. But we need to, I think one of the key parts of that is really putting together, and we'll, when we go to budget formulation, there's a document that goes forward from the Navajo Nation and really stressing how we want to do that. So that's number one, I think, is that we're one of 12 areas within the Indian Health Service. And so even we need to have a very strong position at the local level so we can, because everything will get rolled up at the headquarters level. So sometimes that dilutes the everyone asking for their priorities and those kinds of things. And some of the things that we have talked about over the years, of course, is the facilities, water infrastructure, agency, hospital, and clinics, and PRC. Those are all, but there are factors that are taken into consideration when there is a distribution made, and that's why we work very strongly to try to make sure that we're collecting all of the user information. So a user within the Navajo area, or for Indian Health Service for that matter, is someone that has used the IHS or tribal system one time in the last 3 years, which means that if I go into see a dentist, then I would be counted one time in the last 3 years of I've been seen there. So what that means is that all of the data systems that get rolled up to when we do a data dump, whether tribal programs use RPMS, our IHS data system or not, there are mechanisms now for all of this data to get into the IHS system. As I've seen over the last 2 years, our user population overall for the Navajo area is going down, and I think I've raised this before. There's a problem there. Either patients are not coming to see us anymore, which I don't think that's entirely true. But the other part is that are we getting, is every facility exporting their data properly, and is all of our data being reported? I think over the past 2 years, each year at a time, we're less and less 5,000 members, 5,000 users. So that means that if that goes down for whatever reason, then if they're using user population for distribution, then we're going to get less than we did in the prior year because the distribution is based on user population. So that is one factor and one reason why we're strongly encouraging a better understanding that those numbers those visits that are being captured at the local level are critical, and they need to get into the IHS system. And that just happened. And so our new numbers for user population will come out. I did see the draft numbers, but I went back and asked our statistical staff to go back and verify with each 638 program to confirm that all the data was in there. That's what's going on right now before I certify that I'll accept those numbers. I don't have much else to argue if the numbers are not there, but if there's a way that we could do a data dump and make sure that our data is there, that's going to be key. That's just one part of how we do it. PRC generally has a separate distribution process. Again, PRC, purchase and referred care, or what used to be contract healthcare, those are, again, critical to Navajo area. I've shared reports of how we're using all of those funds in the Navajo area, especially during the pandemic, and how we've utilized it to cover the transfers that we have that have occurred. So again, all of that information in general, you're looking at active PRC individuals and that's how they're using to distribute those funds. So the rules that apply to PRC, like the community of residence, if I live in a specific community, I got to make sure that I'm being counted. And so that goes back to the entry point of our healthcare center. So if you go to healthcare center, they're asking you, is your address still the same, and is all of your demographics still the same? That's absolutely critical, because if we have people that, a lot of our people migrate and they go to Phoenix or they'll go to Albuquerque and come here. So we want to make sure that we're capturing people that we're serving within our area. So that's, again, we can spend a lot of time talking about that part, because it's very important that we have good data in our healthcare system. But those are at least two indicators that I'm aware of. And then, of course, when we have these contracts with our 638 partners, there is no mechanism to reduce those funding sources. So whatever distribution is made, that it cannot reduce the funding source that we have agreed to in the contracts with the 638 programs. So that means that there has to be some kind of a base that's established, and then generally any new funds that come out, you're using these different methodologies to distribute those funds. Thank you, sir.
Thank you, Ms. So. Committee members, any follow-up statements or questions? Okay. Thank you, Ms. So, Mr. Yazzie, and colleagues, Honorable Crotty and Honorable Walker, for adding to the discussion, and all the folks that are on the call.
Mr. Chair?
Yes.
Hi, Yate, Shanandai, members of the Health Committee. This is Rosalind from Division of Social Services. I just want to convey that historically, the Navajo Nation during these budget formulation has used or relied upon funding methodology that included the disease burden, the geographic isolation, for example, the great distance, traveling distance to hospitals and clinic, the population, the Navajo Nation demographics, like the unemployment, the socioeconomic data, the user population. Those have always been part of the Navajo Nation's position to the national level to advocate for equitable funding strategies, and then the methodology that was always at the forefront for the Navajo Nation, and also looking at the utilization of the Medicaid, Medicare, like Ms. So indicated, the the purchase referred care data, S-chip, and the GIPRA data. So those have always been very supportive for Navajo Nation in advancing its position at the national level, advocating for its equitable funding. Mr. Chair?
Thank you, Ms. Begay. I appreciate your input and thank you for participating. Okay. Committee members, at this point in time, it's just kind of like, oh, we certainly have a void to fill. Who will help us write our position statement? The natural entity to basically draft it and write it would be the Division of Health. Because they've already been given the authorities. As you remember, we basically met on those authorities back in February before the pandemic came. And right now, we're going to have to rely on our own resources. So with that, committee members, perhaps an offline discussion among the delegates later today or sometime tomorrow afternoon. So, what committee members? There's no other discussion, then we can. Mr. Marquis Yazzie, I hope that the discussions helps us to give you some indication of how we're going to proceed, and we will again look to drafting legislation for both the Ihs and the Navajo Committee to establish the official positions. And that's the process that we will use going forward.
Chairman So?
Yes.
This is Rosalind. I have to move to another call, but I think that one of the things that I would like to offer is to bring in IHS headquarters, very much like we did, Minette, with regards to CHAP. And I know that some of the other areas have brought in IHS headquarters finance people to really give this high-level perspective that might help us, get ready for our December 2nd meeting and sort of lay the foundation of just how monies flow, how monies are allocated, some of these conversations that we have, and really get us in a position where we can have a more informed and robust conversation. So I know that Marquis was working on that, and I'm not sure where he might be at with that. But that is an option and that we would like to offer. Thank you, Chairman.
Great. Thank you, Ms. So. Committee members, shall we proceed in the manner that we get a perspective from IHS, the National Finance Officer. And we could include that as accepting the report and then doing the follow-up meeting for Wednesday. Ms. So, I wonder if we could accomplish that on Wednesday also.
I know that Marquise, do you have anything else to offer on that? I know that we've been in contact with Ann and maybe Julian.
Yeah, I haven't been in contact with it. I think the only concern that I have is that there may be some individuals who may be taking annual leave or some type of family leave for that particular upcoming holiday on the 26th. So depending on availability, I'll reach out to those individuals to see if that would be possible.
If you
I'll
would,
get back to you.
Yes, if you would, Mr. Yazzie. But we'll proceed with the request on the report on the items that Honorable Carl Slater requested. Anything else, committee members? If not, then we'll go for the roll call vote to accept the report and then to schedule follow-up presentation for Wednesday, November 25. Mr. Mose, roll call vote, please.
Good afternoon, Mr. Chair. This is Julissa Johnson. Mr. Moe stepped away for a moment. I'll be taking roll call.
Yes, go ahead, Ms. Johnson. Go ahead.
Okay. Mr. Chair, honorable committee members, Honorable Paul Begay.
Delegate Paul Begay votes green.
Honorable Paul Begay votes green. Honorable Pernell Halona.
Halona votes green.
Honorable Halona votes green. Honorable Carl Slater.
Delegate Slater green, back on the line.
Honorable Slater votes green. Honorable Charlene So.
Delegate So just.
Oh, I'm sorry.
So say Delegate So just texted the committee indicating that she votes green.
Okay. Charlene So votes green via text. Honorable Edison Winika.
Green.
Honorable Edison Winika votes green. Chair, you have 5 in favor and 0 opposed.
Thank
Chair,
you.
this is Delegate, so I vote in favor as well. My call dropped.
Okay, thank you. Okay, the other committee members, I just received a text from Ms. So. She had dropped from the call, and we may do a teleconference with IHS tomorrow. The one from headquarters finance office. So that is something that we could also add to logistics at the end of our meeting with ALA committee members. And let the record show a vote of 5 in favor, 0 opposed, and the chair not voting. So we've accepted that report. But the latest development is we might schedule a work session for tomorrow afternoon. Shemayez, Ms. Martinez. Can you prepare a special meeting request for tomorrow afternoon?
The 16 hours deadline, Mr. Chair, is gonna, I don't know if it'll get it. Okay.
Okay.
Chair So.
Yes, go ahead, Che.
Thank you, Che. Just wondering how long this meeting will go, because I also have another meeting starting at 3 o'clock tomorrow, Western Navajo Caucus Priorities meeting. So just to let you know, FYI. Thank you.
Okay. So now we have we dispense with the IHS report. Now we go to a report gosh, I misplaced the Ms. Martinez. Item 5C, an update report from
Special duty pay and hazard pay. Mr. Chair, the agenda was mailed out at 12:14. Let's see, 12:02, the updated agenda.
Okay.
12 o'clock.
Okay, committee members, and that would bring up Ms. Rosita Toddy and Dr. Fowler.
Yes, Che, I'm on the line. This is Dr. Fowler.
Hello, Sheila. You have the teleconference line now?
Okay, yat es Che, ado shana shiyaj ado shiche kebeda kahita ado daisenal tsai ihe ado kwa special duty pay do hazard pay nini ya Department of Personnel Management, OOC, and DOJ did meet, and we did reevaluate the special duty pay and renamed it for this new administrative leave as hazard pay. The special duty pay it ended back on August 17th when we all returned to work. So the last day to use that special duty pay was August 16, 2020. We did really had some really good discussions with our OOC and our DOJ. We wanted to make sure that things are well put in line. We did observe some abuse, some of the special duty pay, and the new policy with the hazard duty pay is a little tightened. And we're really focusing on making sure that the hazard duty pay goes to all our frontline workers. And our frontline workers are not only with Department of Health, DPS, Fire Department, EMS, Emergency Management, but also social services and other areas that are determined by the division directors. When the division director determines who should receive hazard pay, they ask when the APE division director they have to make sure that they are mitigating the COVID-19 response. Auditor Lini cares at bed initial agenda yehi based on lake kinahal kaden chidet aniki AIC hashin they have strict guidelines, so we'd like to keep those in place and making sure that we are in compliance. The hazard duty pay is in effect as of November 16th from the beginning of the administrative leave all the way to December 6th of 2020. However, that may be extended by the president, and if it's extended, the hazard pay will also continue. However, again, It's not enough that we say from OOC and myself that we need to make sure that we really adhere to some of these timelines. Ashi and Ni were division directors, and that's the responsibility on us as division director to meet a lot of these deadlines. And we can't afford to miss these deadlines because if we do get audit, so however, we will continue to work with our OOC and then also other divisions. And we're constantly being reminded every Monday. And then also every other day, we try to do our best from DPM. Please understand that DPM, JA, they're not really involved in processing or approving any paperwork. It does not involve any PAF. So it just goes from the division director submitting the proper timesheets, the back pay for exempt, non-exempt. We did send out the salary wage, the hazard duty pay procedures on November 17th. And it was also reviewed by November 17th. But it was released to all our employees, and our division directors are to continue educating their site managers, directors on the proper steps that's in place. As far as workplace safety health, we are doing the best that we can. We did hear from the experts over the weekend, and there are top 3 areas to where a lot of our virus is coming from is our workplace, and number 2 is from house to house, and number 3 is from traveling. So with workplace being the cause of the number 1 exposures, we got to tighten all our CDC guidelines. And again, I mentioned this morning at our division directors meeting. If it's the workplace, we really need to make sure that we abide by CDC guidelines as far as social distancing, making sure that our employees are wearing their masks and continuously doing our walkthroughs. Even though some individuals are working from home, that does not mean we don't attend to our employees. We still need to go make our rounds, make sure that our social distancing are in place. The most important thing that I stress again this morning is to tell people, please, the office gonna auto sun. And I know Thanksgiving's a time to celebrate, but we need to hold off on all these office parties or office get-togethers, even cooking outside, where we're banning that for the time being due to the increase of our COVID numbers. And again, as division directors need we are continuously encouraging telecommuting, and as far as individuals testing positive and negative within our workplace, we are doing our best and reporting it through the portal. And we do have some employees that did tests that even though they tested negative, they're still afraid to come back to work. And we're doing our best in using best practices and following the proper chain of command. And I do tell the supervisors, it's time to get to know the employees. Just if they have computers, do the best in making some tasks to have them work from home. Or if there are some additional duties that you need to have them work on, do your best in coming to an agreement with a telecommuting policy. So we are doing that, and we will continue to educate our people. And I just need everybody that's on this call to assist. Let's assist one another in educating our employees on continuing wearing their mask. Kala e pe khashin tsaka nihidot ne bichet ne pa to ya e hoshin hisna huito as et edo khashin tsaka di hazard pay wal yani ki workplace safety guidelines. As far as the testing procedures, I think I would leave that up to Dr. Jill Jim. She has some schedules lined up. We are doing a lot of testing. As a division of human resources under with the special duty pay, Division of Public Safety, under BIA, December, so we are on top of it. I feel like it's gonna be totally spent because the one that's under BIA for DPS, we did make some changes. We are including some of the social because we do see some numbers increasing in our death rates. So we are moving some monies from the social service to AJ burial assistance. So we are working with DPS and social service as well. So if you want, if you have any questions, you're more than willing to email me and I can provide a response. But I do have Ms. Toddy on the line just in case there are any questions. But like I stated, DPM is mainly focusing on the policy as far as payout, the amounts, total amounts that were payout. Ms. Kurt Otto, the safety areas reporting procedures. It's from Dr. Jim.
Thank you, Setsui. Committee members, Honorable Slater. Does
Chair, can you hear me?
Now we can, yes.
Thank you. The question, I guess the first question I have is, what is the funding source for the hazard and special duty pay? Is that coming out of the program's budget? I guess my understanding is that all unspent and unencumbered funds, would be reallocated on the 20th. So I just want some clarification on that point, I guess, before I ask any other questions. Thank you.
I'll refer that response to Ms. Kurt.
Madam Controller, Ms. Pearline Kurt. Are you on the call?
Chair, this is Controller. Good afternoon, everyone, members of the committee. To Vice Chair Slater, to your question, in terms of the funding source, for the new hazard pay that Dr. Fowler just described, that will be starting November 16th, all the way to December 6th. Obviously, that would be essentially funds other than the CARES fund, other than the Special Duty Pay Business Unit from CJN-46-20. I say that because we had to wrestle with the NABI resolution that put the November 20th as a deadline for including the resolution CJN 46-20. So the way it works is we did send out a report, some numbers, and it does have some amounts of the special duty pay lump sum and the hourly amounts, as well as administrative leave and the base pay for special duty pay, those amounts. Those are all for the first government shutdown from March to August 17th. The last of it was paid out this past week on the 18th, and that would be pay period ended. We ran the payroll November. It's the pay period ending November 6th, and then we processed as much as we could, and that got paid out on 11/18. So because of the NABI resolution, then whatever's remaining according to that resolution gets reverted back as of 11/20. So this one, the hazard pay came up, and so as of now, that would be using other funds other than hazard pay. Although we did use some verbiage or, things sticking with the actual narrow focus of hazard pay, because the special duty pay was way broader. We have our office encountered a lot of issues, and especially when it comes to the CARES business unit. This one, with the hazard pay, using your program's own funds, it will start 11/16, and the new pay period, starting pay period ending 11/20. So first payment is December 1st. The other thing that we observe, and that really, there's a couple things. One, with the special duty pay from the first government shutdown, when I say it's broad, it was, there was a lot of, after the fact, people wanting to essentially declare themselves essential employees so that they can get special duty pay. In some cases, that meant that they will go back and change their time cards, because a lot of those activities were going on, which obviously means a lot of work for my staff. And then the other thing that happened also, there's instances of abuse where people are literally asking to 20 to 25% of their pay. Under the federal rules, the uniform guidance, it does talk about reasonable amount. So the question became, what is reasonable? The other thing that occurred also was that our office put in a deadline of October 26th, because people were still submitting their information, and it was not letting up. So in the interest of trying to meet the CARES deadline, our office put in a deadline. However, unfortunately, there were there's a few divisions that we've made exception for. We allowed them to bring in their documents on the for another day or two. However, in meeting the pay period ending 11/6 to meet the 11/18, actually the 11/20 deadline, our office did what we can to process all of those documents, and there were a lot. I want to say there was 10 boxes that came in that day, October 25th. So what was happening is some of these divisions, they were waiting till the last minute. So if we didn't put in a deadline, I don't know when they would have submitted it. So subsequent to that is the November 20th deadline that got put in place. So that really put a lot of, we had to really put a lot of resources out there for my payroll section to work. I've had staff work on weekends till 8 p.m., weeknights. Sometimes they were up till 2 a.m. trying to get as many of these things processed. There are some departments that, public safety, for example, they've submitted their documents along the way, so they weren't waiting to the last minute. So There are some that didn't meet the deadline, basically, the last payroll that got paid out 11/18. So we have deadlines, and there's only so much my office can do. There's only so much payroll can process in a given pay period. So there has been requests for extensions and things like that, but if we had another broad special duty pay as opposed to hazard pay, I feel for my staff, because it is a lot of work, a lot of going back and forth, although we communicated the best way with the timekeepers, but there's also communication breakdown at some places. So those were all the problems that we encountered. And so if you're hearing about certain divisions not getting paid, that probably would be the reason, not meeting the deadline. The other thing is regarding the CARES business unit, as Dr. Fowler described, it does require a documentation. So there are Treasury guidelines around it. So we really have to scrutinize those justifications. The forms have to be correct, completed with signatures and everything. So for those, the divisions we are early on, like public safety, we were able to work with them. We sat down with them and made sure that their documents were good, but that rush towards the end, I believe, hampered some of the divisions. So I just want to report that as well. I can just add, if you've probably seen the report in the email. So from the first government shutdown up until August 17th, for that time frame, we paid out $1,932,951 in lump sum payments, namely for the exempt staff. This isn't just limited to CARES. This is other business units like your 638 funds or your general funds. For the special duty pay, usually those are time and a half. So the half part is what we paid out was $7,282,877. Those are the relevant numbers that is key. So we paid out close to $9 million in special duty pay on top of the base pay and so forth. So I just want to report that as well. Yeah.
Sure. So are you still on the line? Committee members, can you hear me? This is Delegate Slater.
We can hear you. Yeah, we can hear you.
Okay, thank you. I reconnected with the call instead of the internet audio. Chair So has indicated that he has a commitment with, I believe, the Attorney General of New Mexico, and he will rejoin us shortly after 2:30. So, committee members, as Vice Chair, I'm going to take over as Chair Pro Tem. The floor is open to questions to the Controller or to Dr. Fowler or anyone else on the report.
Vice Chair, this is Monica.
Chair, you're recognized.
Okay, thank you, Vice Chair and members of the committee and presenters. Yeah, a lot of staff at Isha, but the concern with me has to do with CXR. There's quite a few calls that I got because I used to work with all the chapters, all 110 for so many years, and I got to know the chapter officials and staff and all that, CXR that Ahida.
And I've been getting quite a few calls from CXR where frontline go. I don't know why. There's only certain ones that are getting paid hazard pay. I know. Who makes the determination who gets hazard pay? But based on the presentation you made, you just got the box a while ago, and you're still taking it to the process. That's the process. And I told each one that called me, I told them, I said, you need to give me your name and I can express the concerns that you have. I don't want to be retaliated against. I know. Certain managers and supervisors, I guess, really use their authority to kind of limit the information that we could get from the staff. And I don't know. I don't know if the manager over there, Jeline Begeda, if we could just have her talk to us. If she feels the same way, so retaliation, I don't know who can give us a report on that, exactly what's going on. No. Then that on the state of what ada. On the state, Hashin they are your larger not never sign the show. So those is what I'd never sign this again. A call quite this as far as this hazard pay happening. Other is for Hashin David in Ilio, we don't be ada. Ada Vice Chair, that's a concern that I have. I don't know if there is a response to that. When the people that are making complaints, if they can't come forward, and if they're afraid to come forward, I need it address it now. What ain't the out in his just a call quite this it be a distance and the head now.
Sure, I see that as more of a comment, so I'm going to recognize another individual or two before we go back to the presenters. Committee members or other delegates who have joined us on the call. The floor is open.
Vice Chair.
Delegate Hello, you're recognized.
Thank you. And let's see, already good afternoon, committee members, and also our guests that are on the line. Controller, Ms. Kirk, I wanted to find out, you were mentioning something about a deadline. And then the deadlines for the hardship program, is that still for next week for applications? And then also the deadline for hazard pay. That keeps coming up, hazard pay. I don't know how we're going to settle this. It seems like at every meeting that it comes up, and it still has to be a problem. A lot of people are complaining they haven't received anything. I don't know, Dr. Fowler, if we have any guidelines set up that we can send out to all the workers on what needs to happen there. It should have been done. I imagine it would have been done. Some sort of policy on what that's going to entail. And then all the employees that are out there, they should know already, especially the supervisors. So we really need to get that bottled down and wrapped it up. And what kind of deadlines are we having on hazard pay? I figured it was over by now. It's been over a month. We started back to work. And are we going to start that back up again now that people have been sent home again and there's numbers are going high again on this pandemic? So those are a couple of questions I had right there. Thank you, Chair. Vice Chair.
Delegate Halona, would it be acceptable to you if I directed the controller to answer the hardship application questions or hardship questions after we complete the other reports that we identified on the agenda? Is that okay? I just don't want us to get bogged down in that because I see that opening up a can of worms right now.
Yeah, I know. It's just dragging on, and we need to cap that off and make sure everybody know what the procedures are. So that would be fine. Vice Chair.
Thank you, sir. I'll return to the controller. You're recognized to respond, and then after that, Dr. Fowler, if you have responses to both Delegates Halona and Wanika. Controller Kirk.
Thank you, Vice Chair. Kodo Eya Benda Kidigi. Delegate Wanika, your comments. I do recognize that administratively there's things that go on, namely your employees may have complaints against their managers, supervisors, or directors, and sometimes OOC we wind up somewhere, we're getting blamed or something. So I just wanted to let you know from our perspective, we try to stay out of those management and administrative matters. What we care about when the document gets to our office is not only have we communicated those procedures and so forth, which we have since March through the timekeepers. So, and it's worked because some of the divisions programs, we sat with them because there was some paper shuffling early on, and eventually a good example is your public safety people. We've sat with them and make sure their documents were in order and so forth, and they've gotten paid. What I was describing earlier is those instances where people didn't move fast enough. They weren't moving, making those decisions, submitting their documents, and so forth. So if there's issues between employees and their supervisors and management, then from our office, we don't really have anything to do with that, and we can't help those situations. We only can process what we get through the doors that are accurate documentation, that are completed documentation. And as I mentioned before, it wasn't happening until we put in the deadline. So we only process what, we think is sufficient documentation. The forms are filled out, there's signatures, the correct business units, all of those things. So I just want to make sure that everybody is aware. But we've heard of instances where, management may not be moving on these documents or not approving these for employees, and those questions would be best, directed at those particular division directors, managers, etc. So, Delegate Halona, I'm not sure. I think what you're asking is, you said something about deadlines and then whether these procedures are communicated, which they have. Dr. Fowler can speak to this. We did early on come up with special duty pay procedures, which have been communicated. Again, our office has communicated through the timekeepers on how to fill out all of these things, and that has been ongoing since March. So I hear that excuse a lot where people will say, well, I didn't know how to do it, or the process is too cumbersome. But it has been ongoing. Timekeepers should be talking to their management, their administrators, their financial folks, on how to do these things. And it's been discussed at all levels. Everybody knew about the special duty pay. I've discussed it in front of leadership in various levels as well. So again, we did the same thing with the hazard pay. Hazard pay is meant to be a little more narrow, and that's just recent. We met on it, as Dr. Fowler described, and it's been sent out and so forth. The procedures are similar to what it was before. And so I mentioned a deadline, and the deadline we said was for the special duty pay, and that was in consideration of the CARES deadline. We put in a deadline October 26th, and the reason was that we were still getting documents 2 months later after the government shut down. Our office still was getting documents. We were worried that we will not meet the CARES deadline for the special duty pay utilizing the CARES fund. That's the reason why we put in a deadline. And as mentioned before, we got flooded with information. Obviously, that tells us that some divisions waited till the last minute. So that's the deadline we put in. But then again, more so, the other deadline that I'm talking about is November 20th. That's from a NABI resolution. And so the special duty pay is paid biweekly through our payroll system. And I've been communicating that also. And that one, the last pay period for a payment to go out before November 20th would have been the pay period that got paid on November 18th. And that was the pay period that we ran ending November 6th. So my staff has worked overtime the week of the 9th to get as many of the special duty pay paid out as possible. And so obviously those that are submitting documents at the last minute at the deadline, those have the least amount of chance to get paid. And I believe some of those didn't get paid. And so those are the deadlines. NABI resolution put in that deadline, and we had to, so to speak, live with it from here at OOC. So I'm not sure if I answered your question. Let me know if I didn't, Ideya.
Thank you, Controller. You clarified a few things there for me. I appreciate it.
Ihs, Vice Chair, you want me to respond?
Yes, Dr. Fowler, you're recognized. Thank you.
Okay. Na kodon daidol kidi adoshana kodo CHR Deninigi. CHR community health representatives are frontline workers. Johashin sago a not ani lini a dihe ya alalanj and dasnish but no big etahadini. A call hashi odds it and agitated niche. Jo a division director and linido ado beyado not ani sa nanas ja a be ye yohosni an he hashin sagadi not ani dan linigi big edatosni nihi CHR but no we do consider them as essential. They do make direct contact to their communities. And, you know, all that, we don't need to know about the whole detail of the work as long as the hours that they've worked, the contact they've made. As far as them getting paid, they should be getting paid. Any hours that they've worked, that they were making contact, directing to their constituents, their clients, you know, that process needs to happen. We do continuously educate everybody, and every Navajo Nation employee has an email. And these procedures are sent out the day they are released from our DIT system. And they see it, they read it, they just policy da hot khashine la to de ni khashi hot honda khata de ni we do continue to educate everybody. I will get on my end, I will get with the division director and set up a program managers meeting for all the CHR program supervisors and indicate how much education, what kind of information has gone out from your end. And if it's not happening, it's got to happen. It should have been happening ever since the start of March and April. As division directors, we become accountable for channeling the information down to our supervisory level and then to our employees. So I'll do a follow-up on that for you, Mr. Wanika. And as far as other employees not wanting to report because they're fearful of retaliation, I understand that. Ada bahajil neha ako shikihodot ato ada shit esta nini hot ansata kesi ashin echayu akwante just adonil enitzen do ahot ad o hot ada inisha do yashkonda hashin tsugonan na khanaz lana oyo an hit an denil kesabani khe. For those individuals that feel like they're fearful of retaliation, have them give me a call. I've been doing, I don't know how many mediation meetings since April. There's multiple mediation meetings that I've been doing with the program managers, supervisors, and it's just not with Department of Health, all of the other divisions. And they're afraid, and we can't, although we have to kind of simmer things down, cool things down, and then so a lot of the teachings have to happen. We have to go a step back. And if we have to do that to most of the programs and the divisions, that's probably going to be one of my priorities in making sure that our employees don't feel retaliated or abused or written up. Without the anhishol jishibin na what ahish did nido na so eschech dash de la don zagon dot itasto o what ahijin ondo ya eta. So those are some of the things that I'll bring back to our division and then our program managers. I'll continue to educate if you want me to mediate some of the areas in the CHR field. I did a couple already in that program. And don't, tell them, have them call me. If they don't want to call me, they can email me. And all we have to do is have a nice meeting and just by Zoom. And, then we get done with it. There's a different approach to that. So I can assist in that way. We do have notices. And our procedures are there. Special duty procedures have been there. And if I were to ask somebody, can you please read me the third paragraph of the procedures? What does it state that talks about the non-exempt employees and how to utilize the overtime? If we all knew that, those of us that are on the call that are employed with Navajo Nation, we would know how to communicate that. But not everybody's like that. So that's what I mean. We have to continuously educate our division and our programs. And I will continue to do that to the best of my ability. Thank you
very much, Dr. Fowler. Committee members, other delegate guests on the call? Okay, hearing none, the chair is going to ask a couple questions. So, to the controller and to Dr. Fowler, do you have an estimate of the percentage of hours captured by the submissions thus far? I'm curious to see if we have an idea or an estimate of the total number of special duty and hazard hours and how many the nation will end up paying out. I think that's a very useful tool, or sorry, metric for the council and this committee to have so that we can make better policy going forward. Anecdotally, it doesn't sound great. And when I talk with senior center workers, other folks, CHR as well, people are not reporting that they've received anything. So that's what's deeply concerning for me, is that the policies and procedures promulgated by your offices are not being carried out by management. And ultimately, it's the division directors who are responsible, but a failure of this magnitude, if it is large, and that's what we need to know. Is it something that's just an isolate, or is this a pretty widespread issue? We need more assistance from the president and the president's office in order to see that carried through across the entire Navajo Nation government. That's question one about the approximate hours. And then question two is something I've asked before, and that is primarily to Dr. Fowler. What sort of management tools or policy tools does this committee or the council have, or we could develop to see better management, particularly when it comes to pay and personnel actions? So I think we recognize that in issue after issue that comes before the committee, that people expect the committee to just wave a wand and then all of a sudden, X issue will be rectified. A lot of these issues have merit, but it's not the place of the committee to move forward. And I always appreciate your openness to speaking with Navajo Nation employees and performing the mediation that you spoke of. So we really need, in my mind, to have some sort of repercussions for management. But the way that things are set right now, where any supervisor or person who has that supervisory authority to, and consequently they are now an at-will employee, it's created this culture of fear and this fear of retaliation that people are talking about, where if you don't toe the line with your supervisor, then you could imperil your career right there when you've never been a political at-will appointee or anything to that effect. So, I've asked before about what do you think the effectiveness is of that right now? And I think the last time we had a response, we're still evaluating it. And, you walked through some of the efforts that the president made. I think he had placed a moratorium, but it seems like some people have been fired. And at the same time, I don't want us to keep our employees in limbo. But from the mere responses back to this committee, from department managers across the Navajo Nation, from division directors across the Navajo Nation government, there is a lot that's being concealed, obfuscated, and we're not getting the full sunlight on government, particularly in a very intense time that we need. And that's my request to you. So those are the two questions for right now. And then committee members, we haven't had a motion or a second. So I will request for a motion to accept the report.
Motion, Delegate Paul Begay.
I'll recognize a motion from Delegate Begay and then from Delegate Halona. I'll turn to Dr. Fowler and then Controller Kirk.
Thank you for your question. And as far as the tools management that we could develop that could better the overall management, and taking repercussions of management. And when I came to the nation, one of the biggest part was about the at will. And from where I come from, is that effective? What's the effectiveness of that? I created tons of pros and cons, and what part, and then going into looking at it from the legal aspects, of if you're going to terminate an employee, whether they're at will or not, you got to have clear grounds to where you did all you could in orientating this particular individual. You did all you could to working with this individual to have him or become better for what he or she was hired for. So with all that, there's a lot of education that needs to happen within our leadership, and really educating about micromanaging, educating about understanding the different leadership styles, understanding human nature, understanding an individual's human skills and how to empower individuals. There's so much to leadership, and it all starts with the individual, him or herself. And how I'm answering your question, I have to be very careful of how I was brought up, how I learned about being a leader. If I can withstand harsh criticism, I can build on it, but not all our leaders are that way. We really have to understand our leaders. And when I came here, one of the first things that I had done with the program supervisors that report to me was, I need to understand your leadership style. How do you communicate with your people? How can I better empower you? What do I need to provide you to become a better leader? I'm not going to be here forever, but I want the nation to grow. I want the nation to have an open mind to all different kind of human relation skills. But really, bottom line, it starts with us as an individual. What styles do we have? What approach do we take? And we need to think more outside the box and really be analytical and critical thinkers. And that's what's missing. Some of us, we just jump to conclusions. We just go way up above without thinking of some of the consequences that we may have. It's easier said than done. I could say, well, I have a manager that is, not up to par, is incompetent, but that does not mean I'm going to get rid of this person. That means I got to give them some tools, give them a good kit to where they become competent. And that's so much education that needs to happen. I'm willing to provide a written response to you, Ihs, some of the recommendations that I feel that could work for our nation, and I'm willing to put that together and share that with this committee. Thank you.
Thank you, Dr. Fowler. Controller Kirk.
Okay. And thank you for the question, Otto. So in terms of the first question, I'm not too clear, but I will try my best. I think you are talking about the percentage hour captured by the submissions. We're looking into maybe some sort of employee count to see how many employees did get some sort of payment. But I just want to point out that on the report that I sent out, we did have two other figures that is important. We have the special duty pay base, which means that in order to get special duty, you have to reference your base pay having been essential and that you actually work hours. And so on the report itself, you'll see that last figure, which is a $27,873,204. So essentially, that's the base special duty pay base, meaning that you put in, let's say, 8 hours, and if you're hourly, you got your rate, and then if you put in for special duty, you got half of that rate as your special duty pay. That's the 0.5. So, and then on anybody who wasn't on special duty pay, that administrative leave during that government shutdown was $36,415,282. So during the shutdown, employees either got administrative leave pay, or if they were working and they're declaring to put in for special duty pay, then it showed up in either of those two numbers. So because people were retroactively going back, changing because they wanted to get special duty pay, they literally have to take from the admin leave and put, we were correcting information from taking hours or pay from the admin leave to special duty, the base pay. And so that also hampered a lot of our, if you recall from CJY-67-20, the payroll support program for CARES, because admin leave was actually allowable under CARES for reimbursement. So we reimbursed $42 million on that side. So that's where I was saying early on when the government shut down, some departments, programs, they put everybody on admin leave, even though I assume some workers were actually working, but it was, I guess, the easiest thing to do. And so when months later it goes by, then employees are saying, hey, wait a minute, I actually work. So then in order to get special duty pay, they have to change up all the time cards. So that was a big endeavor. So we can get an employee count if we're able to figure that out. We haven't, the only thing pending with our office, I will have to let you know that because of the November 20th deadline, we put whatever we couldn't get through, because as I mentioned, we got boxes of documents. So far, we process as much as we can for CARES. We process, so what we have remaining, and I will have to tell the committee that those that are probably the last minute that were giving us their documents was NDOH, DCD, and DSS. Obviously, it's concerning that a lot of those folks are frontline and so forth, and they do deserve the payments. So I would venture to say that most of them probably did not get paid. We do have, in terms of how the process works within OOC, those submittals go first to contract accounting for review if they're using federal funds, including CARES. And then it goes to payroll. Payroll's the last stop. So right now, as I mentioned, we got 10 or more boxes at the end of October. And we still have, contract accounting has 3 boxes full that were not processed. And we think that that's not just CARES money, that's others. And then payroll has 4 boxes that's unprocessed, and all of those are CARES. And so because of the 11/20th deadline, we had to, set those aside. Contract accounting, there are 3 boxes. If they're not utilizing CARES business unit, then the rest we can process those. So just to kind of give you an update, I'm not sure if we haven't obviously begun getting documents in for the hazard pay itself. But I just want to point out a couple of things with the way we structured the hazard pay due to the problems we encountered with the special duty pay, we put in deadlines. Basically, divisions, department programs have one pay period after they've submitted their time cards to submit their forms for hazard pay. Deadlines are important because from our office we see a lot of people not paying attention to deadlines. The other thing we put in was we made the assumption that the timesheets will take, if there's any discrepancy between forms, the hazard pay forms and the timesheets, we're going to go with the timesheets. I think that will eliminate some going back and forth and so forth. And so those are two key things from our office that we made sure was in the new hazard pay procedures, because I think that will help the process a bit. Again, for the various divisions, programs, etc., we see a lot of problems with not meeting deadlines. For example, this just happened with fiscal year end. People don't get their PAFs updated, and it ultimately we get the blame for it, and then we're also pressured to do what we call in between pay cycle, requests for pay. And it's really hard because our office is charged with doing not just payroll, but we also do deposits for employment taxes, our pension, and various deductions. And so for us to be put in a position of running these interim pay is problematic, very problematic. So we've stopped that practice about a year ago, and we still get some requests. But what happened at fiscal year end is our system depends on the program's ability to update. Our system depends on management submitting their PAF. And if they don't do it and it doesn't get processed in HRIS, and then we can't run payroll. But most times we get blamed, we listen to the irate employee not getting paid. But ultimately that's the responsibility of management to make sure that every one of their employees have their documents updated. And that doesn't happen a lot. So it's, we set out our payroll cycle schedules. We have it on our website. It gets communicated to the timekeepers. So every timekeeper everywhere should be aware of our deadlines and our process. So I just want to throw that in as well. Yeah. Let me know if I didn't answer your question.
Thank you. Okay, so the question I was asking is, there is, whether people submitted or not, a total number of hours that were or could have been eligible for CARES Act reimbursement or payout in the first place. And then there is going to be a number of hours that will be paid out by OOC and the Navajo Nation government to its employees. And what I want to know, and what I would think is important for the committee, is at the end, when all the accounting is done, we have an idea of what those numbers are and what the percentage is. Because that's the scorecard. And then we can look at policy-wise, how did we inhibit or support the payout of the special duty and hazard pay. So we don't need an immediate answer right now. It's not going to change anything, but I've asked a similar request in the past, and I just want to reiterate it now. Committee members, do we have any other questions at this time or comments? Okay.
No question.
Vice Chair, I can answer a bit on that question.
Okay, Controller, we've just spent a lot of time on this report, and we're already at 2:15. If you don't have the approximate numbers right now, I think it would just be better if we roll it over into a later report. Like I said, it's not going to impact anything right now, and I know you have a lot of stuff to do with the payouts. But I mean, if you think it's very important to report what you have, we can move to that.
Yeah, I just want to make a quick point. The first element, which is your what would have been eligible, that would be really hard to gauge because you have to justify and document what CARES Treasury guidance and all of those that you have to justify that the work being done by that person is substantially dedicated to mitigating and responding to COVID-19. That's the documentation that's needed. So our office, what we do is we go by the narrative that gets submitted on the forms. And so sometimes we get blanks, we get a blanket statement, we get something that's not related. So that's the more of a judgmental call at that point. So if we don't know that ahead of time, then your first element would be kind of hard to gauge. So just so you know, based on what you were describing. Thank you.
Thank you, Controller. Yeah, I think a part of it is that there is some sort of subjective analysis that takes place, but we need to have an idea at some point, and we need to be able to quantify it. And that could take the shape of, an after-the-fact survey where we look at the work that was performed, and each division can kind of do their own self-analysis. But I think hopefully it would help this whole process in the future. Thank you very much for clarifying that. And then the last thing I want to say before we go to the vote is that I think anyone who's had to use the personnel policies manual as an employee or as a delegate, evaluating the merits of each policy, et cetera, knows that it effectively has everything you need to be a good manager. And we see really good management in a lot of programs, but it's not enough. And I would say it's not even close to a plurality of the programs within the Navajo Nation. So because of that, what Dr. Fowler said is so critical. And I think the frustration that I heard in the 23rd Council among many delegates, wherein we know the policies exist, we know that all the mechanisms for management exist. It's just not happening. I think it was, I won't share his name, but he said all the Navajo Nation employees should have to reapply for their jobs. I don't believe that. That's way too harsh. That's ridiculous. It's throwing the baby out with the bathwater. But I'm pleading with the committee, with Dr. Fowler, and with all the listeners on the call. We need to figure out how to get more responsive management. And I think it needs to be a systemic approach. It's not just pay. It's not just the labor policies or anything like that. And perhaps one of our goals, committee, as we've set up our fiscal year 21 goals, is to address that matter and maybe hold a series of listening sessions or work sessions with our employees to hear a little bit more about that. Thank you to the presenters. And who is doing our votes now? Ms. Martinez? I guess it's not Mr. Mose, or is Mr. Mose back?
Mr. Mose, are you still on the line? Vice Chair, who seconded the motion? I'm sorry.
I think we had a motion from Delegate Begay and a second from Delegate Helena. Mr. Mose, are you on the line? Okay, thank you, Ms. Martinez. Please proceed with the roll call vote.
Roll call to accept the report. Honorable Paul Begay, Jr.
The Paul Begay votes green.
Honorable Pernell Helona.
Helona votes green.
Honorable Charlene So.
I vote in favor.
Honorable Daniel Ihs. Honorable Edison J. Wanika.
Green.
Back up to Honorable Daniel Ihs. Mr. Chair, you have a vote of 4 in favor.
Thank you very much, Ms. Martinez. Thank you to the presenters. I'm sure we'll be speaking with you again shortly. And we definitely will with Dr. Fowler. Ms. Martinez, can you introduce item 5D, please?
Item 5D, report from Daltex regarding senior centers. Presenters, Dr. Jill Jim, Leonora Henderson. Mr. Vice Chair and members.
Committee members, before we go to that, I just realized that I erred in the last report. It was supposed to include the workplace safety precautions, and we went into special duty pay at the outset. So we've accepted the report. I don't know, is Mr. Azeret on the line? Or anyone from General Services or Division of Human Resources? Okay, hearing none, then Dr. Jim, are you on the line, or Ms. Henderson, are you?
Good afternoon, Delegate Slater. This is Leonora Henderson. I am not sure if Dr. Jim is going to be attending this call right now, but I am here and I can answer the questions that you have for us. I also have our new Health Services Administrator that was hired, and her name is Valerie Jones. She has started today, and I will be here to assist with the transition during this time. So let me have her introduce herself as we right now, and then I can provide the information that you are requesting. Thank you, sir.
Good afternoon. This is Valerie Jones, the HSA with the Daltex program.
I need to go do my laundry. I don't have any clothes to wear.
Hey, whoever's talking about your laundry, please mute your phone. I can hear you on the call.
Delegate Slater, can you let me know what specifics that you needed to know regarding Daltex?
I guess what I was thinking that you could provide a general update on the guidance provided to our senior centers and their staff for the duration of this most recent public health order and the government, shutdown through December 6th. And then committee members can move into asking their questions. Thank you.
Okay, good afternoon, Delegate Slater and members of the HES Committee. The report right now with the Daltex Senior Centers going forward with this new shutdown, this second shutdown, is that we will continue to operate Monday through Friday, 8 to 5. Our centers are closed to the public. However, we are serving home delivery meals to our high-risk elders clients. We're targeting basically the ones that do not have any kind of help out there and or are unable to provide or cook a meal for themselves. Those are the elders that we are focusing on right now. As far as the staff are concerned, they are limited to their senior center throughout the day, and much of the stuff that they do are working on within their senior centers is just sanitizing, updating files, and doing basic maintenance and repairs at their senior centers. Right now, all of our senior centers are open except for several in each agencies where some of the staff members have tested positive and are now in quarantine and away from the senior centers, and those senior centers are closed for now until everyone is clears and they test negative. Then they will be allowed back to work. Within Chinle Agency, I believe we have centers. Crown Point Agency is 2 centers. Fort Defiance Agency is 2, and I believe I think there's going to be 2 more, but I haven't got confirmation with Fort Defiance Agency. Shiprock Agency has 5 centers that are currently closed due to the positive tests, and Tuba City has 4. Right now, the agency offices are operating, except for Tuba City and Shiprock Agency. They are working remotely as someone has tested positive in their agency office as well. So as far as PPEs are concerned, our staff are adequately supplied with PPEs. We have stockpiled over through these last several months to where they have enough PPEs to cover themselves, and basically we're just telling them just to send one person out of the building, and that which is the driver that delivers the food. And cleaning supplies they have, food they have, the food is okay. They're able to work and order their foods from Blue Mountain Meats, and also they have their local grocery stores that have their purchase orders there in case they need something right away that they don't have on hand. So all of that is available for them. And I know there was a mention about hazard pay, special duty pay. When looking at talking with the agencies and talking about special duty pay for our Daltech staff, majority have gotten paid all the way through they have gotten back pay from March through August. They have received that. Many of them have already been paid out, and I believe this coming pay period is the last pay period that will show that all of the Daltech staff have been paid. Now, going forward, starting with November, this new shutdown and the special duty pay, we did submit the documents that was required by payroll section, so those are in place, and the staff are aware of the documentation that they need to provide in order to receive this special duty pay. That concludes my report. I'm not sure if you have any other questions. Thank you.
Committee members, the floor is open now.
I don't have anything, Chair. Thank you.
Vice Chair, Delegate Paul Begay.
Shanella, please proceed with your question. You're recognized.
Oh, thank you, Shanella, Vice Chair, also committee member. Thank you for the presentation. Just one question. We know there has been, we are told that PPEs are available at the centers. Now, is this PPE also supposed to be made available at the office, maybe agency offices? I'm not sure about that. If we're informed that they are also being supplied with PPE, because I have been told that some of the an office is not does not have PPE to cover their staff there. That is mainly my question. Thank you.
Thank you, Delegate Begay. Committee members or delegate guests on the call, I'm open to 1 or 2 more comments or questions before returning to the program. Hearing none, we'll return to Ms. Henderson. And then can you identify the roles and responsibilities of the HSA? I assume that's an appropriate abbreviation for the Health Service Administrator title, just so the committee and everyone on the call has a better understanding of what that position fulfills. Thank you.
Okay, Delegate Begay, thank you for the question. Here at Central Office, when we receive the PPEs we receive it here at Central and we distribute it equally among the agencies. And from there, the agency staff, personnel pick it up, and from there, they take it and distribute it among their senior centers. So when we do this distribution, we keep in mind agency office as well. So that is how I distribute it from here, and that's how they've been receiving it. And it's up to them at their level, agency level, to make sure and ensure that they have those PPEs available for their staff, which was given to them. The job description, the HSA is, yes, the Health Services Administrator. And basically, the responsibility of this Health Services Administrator is, I'm going to read the job description from the DPM personnel website, if that's okay. Otherwise, I don't know if that's okay to do that.
I mean, that's fine. I guess it's more at your discretion, because the point is to educate the committee and everyone listening on the position and then how it will be fulfilled within the Department of Health and how it will affect our senior centers. So if you think that's the best way to do it, then go ahead. Thank you.
Okay, according to the job description for the Health Services Administrator, the duties at the position entails, directs, and oversees the planning, development, implementation, administration, and evaluation of the Division of Aging and Long-Term Care Support activities, provides leadership to ensure understanding of program expectations, and to promote comprehensive aging and long-term care program objectives. Also, to oversee the overall development and expansion of aging and long-term care services, develops and establishes short and long-term range goals through strategic planning process, monitors the progress of the program activities, advises and consults with executive director on formulation, revision of policies, procedures, standards, protocols, and guidelines, ensures compliance with federal, state, local laws, rules, regulations, and administrating of operating budgets, directs the preparation and submission of grant applications and proposals, participates in contracts negotiations, develops, implements, and evaluates aging and long-term care planning initiatives, keeps abreast of developing changes and trends regarding aging and long-term care services, provides guidance in planning and determining the direction of the program, oversees the development and implementation of client management system, oversees elder services studies and the development of changes and implementation of approved services, provides oversight and guidance for assigned staff, conducts performance appraisals, and handles personnel issues in accordance with policies and procedures, provides technical assistant expertise regarding assigned functions, establishes and maintains network and collaboration with elder service providers and healthcare organizations, prepares technical reports, represents Department of Health regarding aging and long-term care matters, performs other duties as may be assigned. That's the basic duties and responsibilities of the Health Services Administrator.
Okay, thank you very much. Committee members, are there further questions or comments at this time? Okay, I think we're all tasting or smelling the turkey right now. So I'm going to ask just a couple more questions and then we can proceed to the vote. Ms. Henderson, what is the status of the Title III Contract and Elderly Trust Fund monies? And do you have an updated budget expenditure report for the external funds that have deadlines at the end of December? I remember reviewing one, and I'm pretty sure there was CARES Act funding, that was separate from the nation's allocation that came through under your contracts or what have you. And I'm interested in either getting an updated one for the benefit of the committee, or if you could just very briefly go over them at a high level. Thank you.
Okay, Delegate Slater, thank you. The status of the Title III contract right now, the contract is currently sitting at OMB with we're waiting for the business units to be established, and once they are established, then we can go ahead and start utilizing those funds for food and transportation. They were working on it last week, but unfortunately with the shutdown again, the individual, Ms. Harrison, has been in and out of the office. So Friday she was there. She wasn't able to complete it, and I haven't heard anything from her today. So I hope that's what she's working on again. And as far as the trust funds, we do have trust funds, and those funds we use to assist elders in buying either eyeglasses, hearing aids, or dentures. One of the three they can request for us to purchase for them, and we use these funds throughout the year or until the funds have been depleted. I think the amount for this year was $237,000, so we divided that among the 5 agencies, and that amount is what they use to assist their elders in their community. That's the trust fund. As far as the expenditure report for the CARES Act, there was one that was for the last fiscal year, which included Title III and Title VI. Title III, that has expired, and Title VI is still currently being used right now, and that's what we are using to purchase specifically PPEs for our senior centers and just emergency repairs and maintenance that are needed at the senior centers. As far as the Title III for the CARES Act, like I said, that one had expired on June 30th. So we didn't use all of those funds that were allocated from the Title III, the CARES Act funds. So that was rolled over, I guess you could say carried over into our new fiscal year. And that money that we did not use is coming back to us, and which is a part of the Title III FY21 that is sitting at OMB right now. I don't know the exact amount, but I can get those amounts once those business units are issued, and I can deliver that report to you along with all of the other the budget balances for like New Mexico House Bill 2 and general funds. Thank you.
Okay, thank you very much. visited some senior centers before the government shut down, and I was just disturbed by the amount of food that was in the freezers, and I just would like to see us process things as quickly as possible. And as you're aware, if there's anything the committee can ever do to help expedite processing, or if you think there are procedural or policy changes that can be made to expedite grant acceptance and drawdown, we're all ears. Committee members, any further questions?
Delegate Slater, this is Leonora again. I
Okay,
just wanted to add one thing to that, your last comment about an overstock of food in the refrigerators. And that is probably because we were still serving to-go meals, trays, to our congregate clients that were able to drive to the senior center to pick up their meals. But, you know, once the shutdown happened again, we just stopped and literally just doing the home delivery right now. So that is to make sure that our elders are home and being safe and not exposing themselves to this virus. So that was one of the reasons why I think there's an overstock of food right now. But we did look at that, and that was one of the issues that was brought up. And we just did tell them and indicate that we just need to serve what we can serve right now. Thank you.
Okay, thank you. It was actually the opposite. There was not much food that was in there. The last thing I want to say is senior center vehicle is in the shop, and if there's anything that you can do to expedite the rental of one from fleet management, otherwise I hate to see a pause or a discontinuation in services, and I think any of us would feel that way about people we know, care for, and love in our community, and know that there's funding and a way to get it to them. Let's just not let administrative burdens get in the way. So thank you very much for your presentation. Ms. Martinez, can you please proceed to a roll call vote if Mr. Mose is not on?
I'm back, sir.
Mr. Mose, please proceed.
Yes, sir, I'm back.
Oh, actually, we need to establish a motion in a second. The chair is open for a motion in a second.
Motion, Winika.
Second, Halona.
We have a motion from Delegate Winika and a second from Delegate Halona. Mr. Mose, please proceed to the roll call vote.
All right, sir. Honorable Paul Begay Jr.
Delegate Paul Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Halona.
Votes green.
Honorable Pernell Halona votes green. Honorable Charlene So. Honorable Charlene So. Honorable Edson J. Winika.
Green.
Honorable Edson J. Winika votes green. Last call for Honorable Charlene So. Chair, I voted 3 in favor, 0 opposed. Vice Chair.
Thank you very much. Committee members, I think we've exhausted all the agenda items for today. I had emailed out a letter, and it was in regard to the invitation to the Human Rights Commission and the Historic Preservation Department to hold a joint meeting. I believe that Chair So instructed Mr. Mose to sign that and send it out. Mr. Mose, were you able to do that? Mr. Mose, are you still there?
Yes, sir. I haven't been able to do it, sir, but I can do it once the meeting's over. Who do is there a website for this particular organization, sir?
It's Navajo Nation Human Rights Commission and the Navajo Nation Historic Preservation Department. So it'd be Richard Begay at Historic Preservation, and then Mr. Gorman and Dr. Danette Dale on the Human Rights Commission side.
Okay, all right, sir. Okay, I'll do that.
Okay, thank you very much.
Mm-hmm.
Okay, committee members, we have a meeting this Wednesday. I think we've spoken about some of the agenda items we want on that meeting. And, you know, I think I just got an email from Louis Mallet. And give me one moment. This might be relevant to what. Committee members, I'm going to forward this to you. It's pretty clear cut, but we may need to add to the agenda an update on the election lawsuits. It looks like there's a notice of a hearing on a permanent injunction scheduled for December 2nd. I'll forward the email, and we can have that discussion on Wednesday. The chair is open to a motion to adjourn if there are no announcements.
Motion, Monica.
Mr. Vice Chair?
Motion, second.
I guess before I recognize those motions, let me go to our legislative advisor, Ms. Martinez.
Mr. Vice Chair, members, Chairman So asked for a work session or a special meeting tomorrow, but IHS is going to be available until Wednesday. IHS headquarters finance, so they'll be on Wednesday's agenda. So there's no need for a meeting tomorrow. Besides, it didn't make the 24-hour deadline. Mr. Vice Chair.
Thank you, Ms. Martinez. So I think we still could have made it for a 4 o'clock meeting. I'm just kidding. Okay, committee members, I believe we had a motion from Delegate Wanika and then a second from Delegate Begay. In any event, that's how I'm going to recognize it. Any further debate or announcements? Well, a motion to adjourn has no debate. Mr. Most, please proceed to a roll call vote.
All right, sir. Honorable Paul Begay, Jr.
Delegate Paul Begay votes green.
Honorable Paul Begay, Jr. votes green. Honorable Pernell Halona.
Halona votes green.
Honorable Pernell Halona votes green. Honorable Charlene So. Honorable Charlene So. Honorable Edison J. Wanika.
I vote in favor.
Okay, thank you. Honorable Charlene So votes green.
Wanika votes green.
Honorable Edison J. Wanika, you say you vote green? Right.
Green.
Chair, a vote of 4 in favor, 0 opposed. Vice Chair.
Thank you, committee members. Thank you to our guests on the call. Thank you to Mr. Mose and Ms. Martinez and all of our presenters. We'll talk on Wednesday. We're going to.
All right, sir.
Oh.
52.